So, let's start at the beginning. What is lung cancer? Well, lung cancer is basically when cells in the lungs grow out of control, forming tumors that can invade nearby tissues or spread throughout the body. We usually divide lung cancers into two big categories: small cell lung cancer, which is aggressive and strongly linked to smoking, and non-small cell lung cancer, which includes adenocarcinoma, squamous cell carcinoma, large cell carcinoma, and some less common types like bronchial carcinoid tumors. Non-small cell lung cancers make up about 85% of all cases. Risk factors. The biggest one is no surprise: cigarette smoking. In fact, smoking is responsible for around 80 to 90% of lung cancers, but it's not the only one. Non-smokers can also get lung cancer, often due to radon exposure, which is a naturally occurring radioactive gas that can build up in basements and poorly ventilated homes. Air pollution, asbestos exposure, prior radiation to the chest, and certain occupational chemicals can also play a role. Family history can increase risk too, so it's definitely not only a smoker's disease. Now, let's talk symptoms. The most common ones are cough that doesn't go away, coughing up blood, chest pain, and shortness of breath. Many patients also experience constitutional symptoms like fatigue, unexplained weight loss, fevers, and night sweats. And these aren't your normal "I got hot at night" sweats. We're talking drenching night sweats where the sheets and clothes are soaked. But here's where it gets interesting. Lung cancer can also cause really unusual symptoms. And this is where paraneoplastic syndromes come in. The word paraneoplastic basically means alongside the cancer. These syndromes happen when the cancer cells produce hormones, proteins, or trigger an immune response that affects the rest of the body. Sometimes these weird symptoms show up before any chest-related symptoms, which can delay diagnosis if people or even doctors don't recognize the connection. Let's break this down by type of lung cancer, starting with small cell lung cancer. This one is notorious for causing multiple paraneoplastic syndromes. A really fascinating one is Lambert-Eaton myasthenic syndrome. Here, the body produces antibodies against calcium channels in the nerves, which are needed to release acetylcholine, the chemical that activates your muscles. The result is muscle weakness, especially in the thighs, hips, and shoulders. But here's the weird part. Unlike myasthenia gravis, which gets worse the more you use your muscles, Lambert-Eaton actually gets better with activity. So a patient may feel weak when they wake up, but as they move around, their strength improves. Small cell lung cancer can also trigger ESIADH, or syndrome of inappropriate antidiuretic hormone secretion. In simple terms, the cancer cells start pumping out ADH, a hormone that makes your body hold onto water. This dilutes the blood and leads to low sodium levels. Symptoms can be subtle, like headaches and confusion, or serious, like seizures if sodium drops too low. Another one is ectopic Cushing's syndrome, where the tumor produces ACTH, a hormone that overstimulates the adrenal glands. Patients suddenly gain weight around the belly and face, develop purple stretch marks, high blood pressure, and muscle weakness. It can even make them more prone to infections. Imagine the body being flooded with stress hormones 24/7. That's essentially what's happening. Small cell lung cancer can also cause neurological issues like paraneoplastic encephalitis, where antibodies attack the brain, leading to confusion, memory problems, and seizures. There's even something called subacute cerebellar degeneration, where antibodies damage brain cells that control balance and coordination. Patients may stumble when walking or struggle with fine motor tasks like buttoning a shirt. Now, let's move to adenocarcinoma, the most common type of lung cancer, especially in non-smokers and women. One unusual feature here is hypertrophic osteoarthropathy. This is where patients develop clubbing of the fingers, meaning the fingertips become bulbous and the nails curve downward. It looks subtle at first, but if you press your two index fingers together, the little diamond-shaped space that normally appears disappears in clubbing. Along with this, patients may have painful, swollen joints and bone pain. Adenocarcinoma can also trigger paraneoplastic dermatomyositis or polymyositis, autoimmune conditions that cause muscle weakness and characteristic rashes, like a purplish rash around the eyes, called a heliotrope rash, or scaly bumps on the knuckles. These aren't the first things most people would associate with lung cancer, but they can actually be early warning signs. Next, squamous cell carcinoma. This one is famous for producing PTHrP, or parathyroid hormone-related peptide. Basically, it tricks the body into thinking it has too much parathyroid hormone, leading to high calcium levels in the blood. Hypercalcemia can cause muscle weakness, constipation, abdominal pain, kidney stones, and in severe cases, altered mental status. Patients sometimes come in confused or very sleepy, and only later do doctors discover an underlying lung tumor driving the whole process. Then there's large cell carcinoma, which can secrete human chorionic gonadotropin, HCG, the same hormone detected in pregnancy tests. In men, this can cause gynecomastia or breast tissue growth. In women, it may cause missed periods or abnormal uterine bleeding. So yes, a lung tumor can literally mimic pregnancy. And finally, bronchial carcinoid tumors, which are rare but can produce excess serotonin. This causes carcinoid syndrome with flushing of the face, severe watery diarrhea, wheezing, and sometimes a distinctive heart murmur on the left side of the heart. Now, before I go on, if you're finding these insights helpful, especially the weird ones you probably haven't heard before, make sure to like this video and subscribe to our channel. It really helps us reach more people, and you'll get notified whenever I post new lessons like this. All right, let's add in some new developments. In the past decade, and especially by 2025, research in lung cancer has exploded. We now know that lung cancer isn't just one disease, it's hundreds of different subtypes defined by genetic mutations. For example, some adenocarcinomas carry mutations in EGFR, ALK, or ROS1 genes. These can be targeted by specific pills that block those mutations. Drugs like osimertinib for EGFR or alectinib for ALK have dramatically improved survival compared to chemotherapy. Patients can sometimes live years with oral targeted therapy with far fewer side effects than old-school chemo. Immunotherapy has also been a game-changer. Drugs like pembrolizumab and nivolumab, which release the brakes on the immune system, are now standard treatments for many patients, even in earlier stages. In 2024 and 2025, large trials showed that combining immunotherapy with chemotherapy before surgery, a strategy called neoadjuvant therapy, significantly improves cure rates for non-small cell lung cancer. For small cell lung cancer, which has always been tough to treat, new immunotherapy combinations and antibody-drug conjugates are showing promise. There's even research into personalized cancer vaccines that train your immune system to recognize tumor-specific mutations. So the bottom line is this: lung cancer still carries a heavy burden worldwide, but the future looks far more hopeful than it did even 10 years ago. Let's wrap this up. Lung cancer can look like the usual suspects: cough, chest pain, coughing up blood, but it can also hide behind really strange symptoms like muscle weakness, seizures, rashes, finger clubbing, or even hormonal changes. These paraneoplastic syndromes are like the body's warning signals, sometimes showing up before the cancer is even visible on a scan. The key message here is don't ignore persistent or unusual symptoms, especially if you have risk factors. Diagnosis is improving with advanced imaging, biopsies, and genetic testing, and treatment has expanded from surgery and chemo to targeted pills and powerful immunotherapies. Survival is improving, and research continues to push the boundaries. Thanks for sticking with me through this. I hope this video was helpful. Please like the video, subscribe to our channel, and share it with anyone you think might benefit. That's all for today. Take care, and I'll see you in the next lesson.